So what is history? For many, history is the ancient past. For others, history is what we hear from family members. For me, history is all of those things and more. History is about voices. And for me, because I care for the health of all, I care about the voices of all. So therefore, when I started doing my kind of medical history, which when I started off was called the social history of medicine, it is now called global health histories. We at York have actually been able to redefine a specialism within medical history. It meant that when we studied the world, we did not want to see the world through the prism of a few American or North American and European eyes. We wanted to see the world in its own terms. And as we were studying those multiple contexts, we were aware that there were inequalities in those contexts. And because of those power inequalities, some voices could be heard more loudly than others. And our job, I thought, as historians, as sometimes been publicly funded and as universities have privatized, I've been very fortunate to get Wellcome funding, and I remain very grateful for the level of Wellcome funding I've received, Wellcome Trust funding I've received. What this allowed us to do was to listen carefully to the people whose voices were usually drowned out by elites around the world. So the history I study, or the history I study with many colleagues from all over the world who come to uncover many voices from many contexts through many languages, because I'm linguistically constrained. I only speak 2 Indian languages. But I've been fortunate in having colleagues come and study, research in our center, and they bring in many, many more voices, which allows us to study diverse links with policy and society. So in 2004, we started working with the WHO quite informally, thanks to the interest of some senior WHO officials, and we created a program that was at that time an unofficial WHO activity that was initially funded by the Rockefeller Foundation and some seed funding from the Wellcome Trust. Global health histories was always interdisciplinary in approach. When global health history said we wanted to study the past, we defined last week as the past. It wasn't about the distant past. It was about living voices. It was about going and speaking to retired officials. It was going and speaking to people who were on the front line of receiving healthcare interventions that involved the WHO. The idea was to improve institutional memory. That was the startup idea. There was a recognition, and there remains a recognition in the WHO, that often a lot of money and time is wasted because the wheel is being constantly reinvented. The WHO actually has wonderful examples of success if studied in complexity. That is, success based on local collaboration with local adaptations, with the use of stakeholders who often don't get reported in the final reports that we get at the end of programs. So the unrecognized, the unstudied people. That's what we did. And as part of this, we ran global health history seminars. As I speak to you, we are preparing for, I think, the 123rd. When we started, we were told this wouldn't last 2 years. We're still doing it. And we're doing it to popular demand, so much demand that my team and I often cannot cope. Because we can't, well, one is money. The Wellcome Trust money has been very generous, but there are time issues. There have to be quality issues. There have to be ethical considerations. We're very fortunate to have the Director of Tertiary Healthcare from Sri Lanka here, who after, I think, falling in love with global health history has decided, I think is the first clinician from Sri Lanka to come and do a PhD in the humanities. in the UK. So we are honored to have him. But this is the power of global health histories, interdisciplinarity, where all disciplines respect each other. I'm looking at the watch because I've been told that I'm going to get brickbats in 7 minutes. So personally, that is the sort of voice that interests me. The health worker. It's beyond personal experiences of heroes. A person like that is my heroine. But it's not just about her. It's also about the people she engages with. Global health histories is not about justifying institutional propaganda. In fact, our fiercest, most constant battles are against WHO officials who would like us to propagate on their behalf. We are not for sale. We've never been for sale, and I think I'd rather end the program than be a propagandist for any organization. So the most wonderful thing about the Wellcome Trust is that they have never asked us to take a particular view or choose a particular topic. Global health histories is always uncertain. I always tell my team, my collaborators, that if we become too certain about our approach to anything, there is a problem. We have a problem. We have too much certainty becomes a problem for dictatorship in international health. So it is, I think, good to be humble and uncertain. And an ex-colleague from UCL has just walked in, and he was a very good role model for global health histories. I mean, he will never tell you about this, but global health histories requires travel. It requires face-to-face negotiation. It requires engagement. You can't do it over Skype. You can't do it over phone. And once, I know because people told me, when Sir Mahmoud went to Iran to negotiate the social determinants of health Commission report, I'm reliably told he got a very angry phone call because a certain statement had then been made around that time by the then Iranian president about Israel. And he told the WHO that he was independent. He told the WHO he was Jewish, and the state of Israel couldn't determine his choices. And therefore, and the Iranian commissioner did wonderful work on your report. So this is what GHH does. It learns from good experience, and that was a very, very good experience because we heard this as we were doing our GHH investigations before a seminar about what to do in global health, how to stand up to power. So we try to stand up to power. We are small people, but we can stand up to power. If people trouble us too much, I pretend not to know English, I start speaking Indian languages, and people run away. So, which I'm sure Kamran can do as well. Good strategy, it says. So, so what Global Health Histories does, or tries to do, I think we've all tried to do in our team, is we try to unpick multiple subjectivities and evidence collection, analysis, and presentation. No data is apolitical. No data is objective. We try to understand the subjectivity of data before we use the data, or at least we try to explain to our WHO partners, and now increasingly national government partners, as we've done over 2 years now with the Sri Lankan government, about how data about any topic like antimicrobial resistance can be understood in multiple ways. So unless we understand the multiple understandings of data, or the evidence we think that is presenting a clear argument, unless we accept that people don't always believe our argument and can reinterpret the data, we can never sort of take on and fight resistance, social resistance to antibiotic, to messages that we shouldn't use antibiotics or be careful about the use of antibiotics. So GHH finally is about studying diverse contexts in their own terms, multifaceted histories based on multilingual research always. It's not Anglocentric, it's not Francocentric, Very easy to be because there is so much material in those languages available. When we look at reports, we've always tried to get multiple drafts of reports because silences that come out in the final version of the report, when you study the final version of the report in relation to the many drafts of the report, tell you what the points of disagreement were, then you can chase down those points of disagreements. It's almost like being an investigative journalist. Often you have to have Chatham rules, you have to have very strong ethical protocols about not mentioning people. But at the end of it, after all that paperwork, it really becomes worth it because you are able to engage with such a wide selection of actors that your academic intellectual world is broadened. Histories, as I see it, or history, so I asked you the question, what is history? So history for me is a mosaic. History of global health and international health is a mosaic. If we think of that mosaic as made of 12 pieces, what is discussed in Geneva headquarters by the most senior people is one mosaic. Then there's a secretariat in Geneva, that's another mosaic. You have regional offices, their senior management is another part of the mosaic. They have secretariats too, that's another mosaic. But then you have the governments, member states, their mosaics. And then the societies the governments work with in partnership with the WHO are the other mosaics. So we have to study all of them in order to write an impactful history of policy. For me, such history is a nuanced preparatory tool because I don't agree with academics who claim that history has a predictive role. I don't think history can predict anything. But what history can do is help us prepare for the wide social, political, economic, and cultural complexities that exist on the ground. Let me give you a very small example. The many people who were vaccinated for smallpox, either as children or young adults, in the 1970s are still around. We found through some, again, research like this, for Indian government and WHO partners, when we were looking at the basis of resistance to polio eradication, that some of the resistance to polio vaccination was not necessarily against the polio vaccine itself, but memories of having force used against them during the smallpox eradication program. Many of those people who'd been flattened onto the ground with vaccinators sitting on top of them and then forcibly vaccinating them were still angry. And in many cases, these were now the grandmothers in family units who were extremely, extremely important figures in family, at the level of family health. So these are things that are easily forgotten. And I think these inconvenient truths that fearless academics can bring out can help policy people. I have, okay. It can help policy people. Now, I will not pretend to you, and I don't think anyone, including our keynote speaker, can pretend to you that one set of ideas is acceptable to all. But if we set out to work, do work, in the hope that everyone in the world will love us, we might as well not start. You know, I mean, there'll be likes and dislikes of what you do. Resilience is all about plowing on despite the fact that some people don't like it. But the trick, I think, for global health history is enduring success, which has surprised me and has surprised many other people, including our critics, has been our ability, I think, to search out in every political and administrative context people who think like us and who are committed and who will donate their time, and then creating coalitions and then listening to them for advice about how to create new spaces, use those spaces to broaden the coalition, so to speak. I think it's fair to say the Global Health Histories, which has been based in New York since 2010, has worked because of the quality and the size of the supportive coalition we have. And I'm very pleased that Saranga, who's part of the Sri Lankan Ministry of Health, is here because ultimately, if you don't have support from the member states to advocate you within the WHO, you will get attacked and you will get sidelined. But if you have member state support and you have a coalition of support from member states, the World Health Assembly remains a one country, one vote system, meaning it's one of those unique places where vote from Sri Lanka is the same weight as a vote from India, despite the economic or political disparities of the two countries. So it's been a wonderful lesson for me in international relations over 10 years. And I hope that all the researchers who come to work with us find the study and deployment of international relations with health, so it's also about health diplomacy, interesting and productive. So I'll end there so that I don't get slammed.